Okay, thank you. So welcome everyone to the speech pathology panel session. My name's Jennifer and I work here in the Future Students team at Southern Cross University. Firstly, I'd like to acknowledge that we're on the lands of the Gumbaynggirr Nation today, and I'd like to pay my respects to elders past, present and emerging. We're here today to share some insights in studying at Southern Cross University. It's a 25-minute panel and we have 10 to 15 minutes at the end to answer any questions. Today I'm joined by a fantastic panel. I have with me speech pathology lecturer Melissa Kemp, current student Michaela, and speech pathologist Lisa. So, hi everyone. Can I just please start by asking you to just explain a little bit about yourself and your connection to Southern Cross University? If you could start, Melissa.
Hi everyone, you hearing me okay? Yeah, awesome. So my connection to Southern Cross University has been for about 6 years now, and it's been a wonderful time that I've had at Southern Cross University working in the speech pathology team. So about 6 or 7 years ago I started working at the Gold Coast campus as a clinical educator, so supervising students on clinical placement. And then last year when we started the program, the speech pathology program at Coffs Harbour, I came down here and was appointed to establish the program in conjunction with everyone else at the uni down here at Coffs. So that's my connection.
Thank you.
My name's Michaela and I came to Southern Cross last year and I moved 6 hours here and I'm currently working as a student ambassador. I'm the second year student rep and now I just study.
And Lisa, I'm a paediatric speech therapist at Coffs Harbour Base Hospital, but I've started tutoring here alongside Melissa 2 days a week. So I'm sharing myself between the two roles at the moment and enjoying it a lot.
Thanks, guys. So could I just start with you, Melissa? Could I start by asking, what kind of work do speech pathologists do? We've all heard the job title, but what does it actually look like in practice?
Yep, that's a great question. I just would like to ask the audience who had heard of speech pathology before coming here today. Yep. Oh, good. About half the hands. That's great. The best way to describe what a speech pathologist does is to compare it to, say, another allied health profession like physiotherapy. And if you hurt a muscle in your leg or your arm, you might go to a physiotherapy therapist to get assistance with that muscle injury. So for speech pathology, it's not just about muscles in terms of head and neck muscles that we use and we take for granted when we communicate, but it's about how our brain works with those muscles to create communication and swallowing. So speech pathologists assess and provide support for babies, so babies after they're born, right through to end of life, so adults right through until the end of life, with their communication and swallowing. And communication is multifaceted. It's how we make sounds to speak, it's how we understand language, it's how we express ourselves, it's how we use our voice and take care of our voice, and it's also how we swallow. So that's the role of a speech pathologist in a nutshell. Yeah, very diverse.
Thank you. So to become a speech pathologist, what is required after graduation? Where do most graduates end up working?
Yeah, so the speech pathology program at Southern Cross University is a 4-year full-time program, and when our students graduate at the end of 4th year, we encourage them to register with Speech Pathology Australia, which is the National Association for Speech Pathologists. And our graduates, well, before they're graduates, they've actually all got jobs before they even finish the degree, because the demand for speech pathology far outweighs the supply of speech pathologists in Australia. So in terms of being able to get a job, it's up there at 100% of our graduates are employed.
And what kind of roles do you see them in?
Well, it varies. If I was a speech pathologist working in a small country town, I'd be seeing babies, children and adults across all those things I described about speaking and communicating and swallowing. But if I was working in a bigger town, like a town like Coffs Harbour, Lisa's working in a more specialised role that just works with children, or I could work in a big city hospital and just work with adults in a particular specialty like swallowing or hearing or stuttering or voice. So it depends on where people want to go and work when they graduate.
Thank you. And is there a crossover between the work that occupational therapists do and speech pathologists do?
There's lots of common ground that we share, and I guess the best way to describe it would be that an occupational therapist kind of looks after the whole person, their well-being, their mind, and their physical health and their occupational health, and a speech pathologist really specialises in the head and neck, so we look after people's ability to communicate, breathe, so think lungs up is speech pathology, and the whole body would be OT, so we would overlap on some of the upper parts of our body in terms of working together on shared goals with the client.
Thank you. And can you tell me a little bit about placements on the course? Like, how does that work?
Our program has almost 1,000 hours of clinical placement over the 4 years of the program, so it's quite a lot. The clinical placement component of our program is really important because you can learn things in classes, but it's going and applying them in real situations, in a clinical situation that's important. So in second year, students do 1 day a week for 12 weeks in our own health clinics that we have on campus, and we've started that just recently here at Coffs, which is very exciting. And then in third year, students do the same thing, 12 weeks, 1 day a week, then another 12 weeks, 1 day a week in the second half of the year, and then in fourth year, they do another 1 day a week for 12 weeks, and then in the last 6 months of the program, students complete 2 6-week block placements, one focusing on working with children and one working with adults. And it's at the end of those block placements that they're assessed as being competent and eligible to become a certified practicing speech pathologist.
That's great, thank you. And finally, what is the advantage of doing the Indigenous Health major on the course?
Yeah, Southern Cross University is really a leader in offering the Indigenous major in both the occupational therapy program, but I don't want you to join that program. As my colleagues are watching me outside the door, I want you to join the speech pathology program. The advantage of doing that program is there's a couple of distinct advantages. One is that we want to attract Indigenous people to study to become speech pathologists, because currently in Australia, less than 2% of the 10,000 speech pathologists in Australia identify as being Aboriginal or Torres Strait Islander. And in a community like Coffs Harbour, where 10% of our population identify as being Indigenous, we'd want at least 10% or more, 20, 50% of our graduates to either identify as being Aboriginal, so that the services that are provided are more culturally appropriate to Aboriginal people and the communities. But the other aspect of the Indigenous major is that students who are non-Indigenous learn how to provide more culturally appropriate services to clients and the community. So, yeah, we're very proud of the Indigenous Health major and hope that we can keep attracting both Indigenous and non-Indigenous students to it.
That's great. Thank you so much. Michaela, as a current student on the course, could you just tell us a bit about what drew you to speech pathology?
I came to speech because I just wanted to help people, but I didn't know how really. And I saw a few people back home that had difficulties in talking. They couldn't swallow. I had family members who had lost their abilities after strokes. I had little cousins who couldn't tell me a word. So that's pretty much what brought me to speech, yeah.
Oh, that's great. And what do you think has been like the most enjoyable parts of studying the course so far?
The most enjoyable part, other than the placements, is Coffs Harbour has such a small cohort. So I get to work very one-on-one with my teachers, ask them for as much help as I want. And I can get along with everyone really well, and we can all sit like this really close.
That's great. So what advice would you give to anybody who's just starting out?
The advice I would probably give is ask for help straight away. Don't push it off, even if you think you can work it out yourself. You might not necessarily be able to, and your teachers will help you even if you think that they don't want to help you.
And just finally, Michaela, where do you see yourself once you graduate?
When I graduate, I want to go back home somewhere, so Moree or Tamworth, and I'm doing the Indigenous major, so I want to work particularly with Indigenous populations, especially with children.
That sounds great. Thank you so much. And Lisa, can you just tell us a little bit about your career and what drew you to speech therapy?
So much like Michaela, I'd had experiences with family members that had accessed speech therapists through stroke. I had a family member who had literacy issues, so saw a speech pathologist for that. So that was kind of the motivation to start, but I really didn't have a really good idea about what speech therapists did till I actually started the course. I really had no idea the massive scope of practice. When I graduated, I moved to Coffs Harbour and worked in the disability industry for 10 years. Actually, I should not say years because it'll give away my age. So I'll just say for the first part of my career, worked in disability. And in disability, I was lucky enough to work with 0 to 65-year-olds and covered communication, swallowing difficulties, voice. It was a great industry to work in. It's a big industry now for speech therapists to work in. I moved to health to work in paediatrics, so specialise a little bit more in paediatrics. Over there, get to see clients from 0 to about 5. It's a great career. Last night I made Play-Doh. That's fun, right? It's a good job. And in health, I specialise a little bit more in the feeding aspect of speech therapy, so work with babies having difficulty with breastfeeding all the way through to toddlers transitioning to foods, and then across the spectrum and scope of practice with, as Melissa described, the speech, voice and fluency issues.
It sounds amazing. So have you found it to be a very fulfilling career?
Yeah, absolutely. Yep. I think what's good about speech therapy is that there's lots of different avenues to follow. So your career never gets, you never feel, I want to say stagnant, but that's not the word I want. I should know my words. I should be good at this. There's always something new. So you're always feeling like you're learning. And that then makes you feel like you're not going to work every day doing the same thing, which I think is important. And you get that variety of client coming through. So you're always seeing and meeting new people. You always feel really actively engaged. You always feel like you're learning. And I think that's really important for a long-term career.
And this kind of leads from that. What difference do you think the work that you do as a speech pathologist can make in somebody's life?
Yeah, huge difference. So communication and feeding, like they're pretty important parts of people's lives, aren't they? So, and especially being socially involved and in communities. So being able to communicate, and eat. You can't go past those two things. It's like being important and feeling like you're doing a rewarding and fulfilling role. Yeah.
That's great. And just finally, what bit of advice would you give to someone that's starting out in the career?
I would say go for it. And I'd say stick at it when it gets hard. And like Michaela has said, I've found the staff here, the lecturing staff, to be really supportive. and I would ask for support when you need it. But yeah, just go for it. It's great. You won't regret it.
Well, thank you to our lovely panellists and sharing your insights into studying at Southern Cross University. I'd like to now give the opportunity for the audience to ask any questions.
Well, I'm just like graduating year 12 this year, and I was wondering if the workload was like, could you balance that with a part-time job as at the same time as full-time study? Like, could you balance that with a part-time job, and how's the workload balance that with that?
That's a great question. Michaela?
So I currently work 20 hours a week plus do student ambassador whenever I want, and then I also study full time. I think it's definitely manageable, but if at times you feel like it's too much, you have to say something because otherwise you're going to overwork yourself.
These guys will be around, so thank you. Just want to say thank you so much. They've been a wonderful panel. If you have any further questions, Michaela, Melissa and Lisa will all be hanging around in the student breakout room upstairs. So if you've got any questions that you don't want to ask here, they'll be here on hand to answer those questions. We also have student support services here today. So if you're wanting to apply or any advice on how to apply, you can do that. That's down at the front near the welcome desk. And I'd just like to say thank you so much, and we look forward to welcoming you at Southern Cross University.